Yeah, so presented yesterday at ESMO 2024 was the TOPGEAR study. This was one of the largest preoperative chemotherapy plus or minus chemoradiation studies in gastric cancer. And this has been the subject of a lot of interest for a long time because people don't know whether or not you should include radiation in the preoperative treatment of stomach cancer. And the study was pretty conclusive, in my opinion, showing that there's no clear role for overall survival in the addition of radiation preoperatively. So the chemotherapy arm performed just as well as the chemoradiation arm in terms of long-term overall survival. So this, while there were improvements in some capacity in the group of patients who got chemoradiation, particularly with respect to some pathological endpoints, the final outcome of overall survival was equivalent. And this was pretty practice-changing, in my opinion, for those who were still using radiation preoperatively. And this was simultaneously published in New England Journal of Medicine yesterday, and in my view is one of the most important gastric cancer trials we've seen in some time. Yeah, so I think now the focus is on can we do better than preoperative chemotherapy by adding whether it's checkpoint inhibitors or other immune modulating agents and targeted therapies. All those trials are ongoing. We'll see a lot more of that in the next year or two. With respect to radiation, I think we really need to focus in on who might be a group of patients who might benefit from radiation. We now know it's not all comers in esophageal or gastric cancer based on the last two studies, ESOPEC and this TOPGEAR study. So I think the emphasis on who should get radiation before surgery is now really unclear. Yeah, so LEAP-012 is an interesting study because it looks at the role of peri-TACE treatment of lenvatinib and of course pembrolizumab. And the question really is being asked of, did this regimen, which is a very active regimen that nearly met its endpoint in advanced HCC a couple of years back, prove to be a good adjunct to TACE? And I think in this regard it seems to be the case. The progression-free survival is very statistically significantly in favor of len-pembro with TACE. So I think that's somewhat reassuring, and in fact that sort of validates an earlier study, the Emerald study, that validated the role of a checkpoint inhibition during and peri-TACE. Now the question becomes, will the overall survival improve? And progression-free survival is still a tricky endpoint in HCC, as we all know. So it is trending favorably in that direction, needs a little more maturity. I suspect that'll continue based on the curves. We will see a statistically significant result. It might take another year, though, or so, because the events need to accumulate, but I think optimistically it should finally meet its endpoint of overall survival. Yeah, so there's, I think, very compelling early phase data with a series of drugs. There's a very exciting target in pancreatic cancer, which is due to be presented at the Presidential Symposium on MTAP loss patients. It'll be, I think, very reassuring to the community that now we have targets of interest in pancreatic cancer. There's also some early studies with claudin antibody-drug conjugates still to be presented, and also, of course, some additional antibody-drug conjugate targeting therapies that are the subject of ESMO. We always have, I would say, a good barrage of studies to be presented from GI oncology at this meeting, and I think this is the case certainly this year as well.